Rachel feels a bit odd. She is wondering why she did not stand. Her bones disappeared. She is now like a worm, crawling to the ground. She is profusely sweating. Her heart is palpitating. She opens up her eyes. Thank God it was a dream. Because of that dream, Rachel is now curious about how bones work and how she can prevent her dreams from happening. Little did she know, her bones are part of the body system called skeletal system. Aside from bones, there are other members of the system that makes it complete. They are the cartilage, joints, and ligaments, and without them, even with bones, an individual cannot possibly move. Rachel's wondering if she also lost her cartilage, joints, and ligaments in her dreams. Now, digging deeper, let's start with bones. The adult skeleton is composed of 206 bones. There are two basic types of osseous or bone tissue. Compact bone is dense and looks smooth and homogeneous, whereas spongy bone has a spiky, open appearance like a sponge. Additionally, bones come in many sizes and shapes. The unique shape of each bone fulfills a particular need. Bones are classified according to shape into 4 groups, which are long, short, flat, and irregular. As their name suggests, long bones are typically longer than they are wide. As a rule, they have a shaft with enlarged ends. Long bones are mostly compact bone but also contain spongy bone at the ends. All the bones of the limbs, except the patella or kneecap and the wrist and ankle bones, are long bones. In a long bone, the diaphysis or shaft makes up most of the bone's length and is composed of compact bone. The epiphysis are the ends of long bones. Each epiphysis consists of a thin layer of compact bone, enclosing an area filled with spongy bone. Flat bones are thin, flatted, and usually curved. They have 2 thin layers of compact bone sandwiching a layer of spongy bone between them. Most of the skull, the ribs, and the sternum are flat bones. Short bones are generally cube-shaped and contain mostly spongy bone with an outer layer of compact bone. The bones of the wrist and ankle are short bones. Sesamoid bones, which form within tendons, are a special type of short bone. The best known example is the patella. Bones that do not fit one of the preceding categories are called irregular bones. The vertebrae which make up the spinal column fall into this group. Like short bones, they are mainly spongy bone with an outer layer of compact bone. Now that Rachel knows the classification of bones, she's now into the internal structure of bones. She wants to reinforce her bones with the information she learned. She discovered that bones play a big role in hematopoiesis or the production of blood. The cavity of the bone shaft, called the medullary cavity, is a storage area for red marrow, which produces blood cells. Children's bones contain red marrow until the age of 6 or 7, when it is gradually replaced by yellow marrow, which stores adipose or fat tissue. In adult bones, red marrow is confined to cavities in the spongy bone of the axial skeleton, the hip bones and the epiphysis of long bones such as the humerus and femur. She was astonished to know that bones are not only for the framework of the body, it also stores important components for the body. As the days pass by, Rachel is getting more interested with the microscopic anatomy of the bones. She then got a sample of her bone and placed it under a microscope. She then saw that spongy bone is composed of small needle-like pieces of bone called trabeculae and lots of open space filled by marrow, blood vessels, and nerves. In compact bone, she saw the mature bone cells osteocytes that are found within the bone matrix in tiny cavities called lacunae. The lacunae are arranged in concentric circles called lamellae around central canals, which are also called Haversian canals. Each complex consisting of a central canal and matrix rings is called an osteon, or Haversian system, and is the structural and functional unit of compact bone. Central canals run lengthwise through the bony matrix, carrying blood vessels and nerves to all areas of the bone. Tiny canals, canaliculi, radiate outward from the central canals to all lacunae. The canaliculi form a transportation system that connects all the bone cells to the nutrient supply and waste removal services through the hard bone matrix. Because of this elaborate network of canals, bone cells are well nourished in spite of the hardness of the matrix, and bone injuries heal quickly. A lot of information, huh? Says Rachel, who have been studying the skeletal system for 4 days now. She's now stuck up and did not know what to study anymore. She thinks she knows everything about the skeletal system and invites her friend Kyla to discuss about her learnings. Kyla listens to her and said that there are a lot more about skeletal system aside the bones. Kyla told Rachel that there is a classification with regards to the skeletal system. Skeletal system is divided into 2 parts, the axial skeleton, which is the bones that form the longitudinal axis of the body, and the appendicular skeleton, which is the bones of the limbs and girdles that attach them to the axial skeleton. Axial skeleton is comprised of the skull, the vertebral column, and the thoracic cage. The skull is formed by 2 sets of bones, the cranium, which encloses and protects the fragile brain tissue, and the facial bones, which form a cradle for the eyes that is open to the anterior and allow the facial muscles to show our feelings through smiles or frowns. All but one of the bones of the skull are joined together by sutures, which are interlocking immovable joints. Only the mandible or the jawbone is attached to the rest of the skull by a freely movable joint. Up next is the vertebral column, or spine, serving as the axial support of the body. That extends from the skull, which it supports, to the pelvis, where it transmits the weight of the body to the lower limbs. The spine is formed from 26 irregular bones connected and reinforced by ligaments in such a way that a flexible, curved structure results. Running through the central cavity of the vertebral column is the delicate spinal cord, which the vertebral column surrounds and protects. This and the S-shaped structure of the vertebral column work together to prevent shock to the head when we walk or run. They also make the body trunk flexible. In addition, vertebrae in different regions of the spine have very specific structural characteristics. These regions are the cervical vertebrae, thoracic vertebrae, the lumbar vertebrae, sacrum, and coccyx. First on the list is the cervical vertebrae. The 7 cervical vertebrae identified as C1 to C7 form the neck region of the spine. The first 2 vertebrae, atlas and axis, are different because they perform functions not shared by the outer cervical vertebrae. The atlas, which is the C1, has no body. The superior surfaces of its transverse processes contain large depressions that receive the occipital condyles of the skull. This joint allows you to nod yes. The axis, or C2, acts as a pivot for the rotation of the atlas and the skull above. It has a large upright process, the dens, which acts as the pivot point. The joint between C1 and C2 allows you to rotate your head from side to side to indicate no. The typical cervical vertebrae are C3 through C7. They are the smallest, lightest vertebrae, and most often, their spinous processes are shortened and divided into 2 branches. The transverse processes of the cervical vertebrae contain foramina, or openings, through which the vertebral arteries pass on their way to the brain above. Anytime you see these foramina in a vertebra, you should know immediately that it is a cervical vertebra. Next to the cervical vertebrae is the thoracic vertebrae. The 12 thoracic vertebrae, T1 to T12, are all typical, larger than the cervical vertebrae, and are distinguished by the fact that they are the only vertebrae to articulate with the ribs. The transverse processes of each thoracic vertebra articulate with the knob-like tubercles of the ribs. The spinous process is long and hooks sharply downward, causing the vertebra to look like a giraffe's head viewed from the side. Another part of the vertebral column is the lumbar vertebrae. The 5 lumbar vertebrae, L1 to L5, have massive block-like bodies that are somewhat kidney bean-shaped. Their short, hatchet-shaped spinous processes make them look like a moose head from the lateral aspect, because most of the stress on the vertebral column occurs in the lumbar region. These are the sturdiest of the vertebrae. The 2 last part of the vertebral column is the sacrum and coccyx, which are the fusion of 5 vertebrae and 3 to 5 tiny, irregularly shaped vertebrae respectively. Coccyx is also known as our tailbone. The third and last part of the axial skeleton, which is the thoracic cage. The sternum, ribs, and thoracic vertebrae make up the bony thorax. The bony thorax is routinely called the thoracic cage because it forms a protective cage of slender bones and cartilage around the organs of the thoracic cavity, such as heart, lungs, and major blood vessels. First part of the thoracic cage is the sternum, or the breastbone, which is a typical flat bone and the result of the fusion of 3 bones, the manubrium, body, and xiphoid process. It is attached directly to the first 7 pairs of the ribs via costal cartilages. Next, 12 pairs of ribs form the walls of the bony thorax. All the ribs articulate with the vertebral column posteriorly and then curve downward and toward the anterior body surface. The true ribs, the first 7 pairs, attach directly to the sternum by costal cartilages. False ribs, the next 5 pairs, either attach indirectly to the sternum or are not attached to the sternum at all. The last 2 pairs of false ribs lack the sternal attachments, so they are also called floating ribs. The intercostal spaces, which are the spaces between the ribs, are filled with the intercostal muscles which aid in breathing. Rachel is getting dizzy with all those new informations running through her mind, but we are only halfway done. Let's move on to the second division of the skeletal system, which is the appendicular skeleton. The appendicular skeleton is composed of 126 bones of the limbs and the pectoral and pelvic girdles, which attach the limbs to the axial skeleton. Starting off with the bones of the shoulder girdle, each pectoral girdle or shoulder girdle consists of 2 bones, a clavicle and a scapula. The paired clavicles or collarbones are slender, doubly curved bones. Each clavicle attaches to the manubrium of the sternum medially as its sternal end and to the scapula laterally, where it helps to form the shoulder joint. The clavicle acts as a brace to hold the arm away from the top of the thorax and helps prevent shoulder dislocation. When the clavicle is broken, the whole shoulder region caves in medially, which shows how important its bracing function is. The paired scapulae or shoulder blades are commonly called wings because they flare when we move our arms posteriorly. The scapulae are not directly attached to the axial skeleton, they are loosely held in place by trunk muscles. Each triangular scapula has a flattened body with 3 borders, superior, medial, which is vertebral, and lateral or axillary. It also has 3 angles, superior, inferior, and lateral. Next are the bones of the upper limbs. 30 separate bones form the skeletal framework of each upper limb, including the arm, forearm, and hand. The arm is formed by a single bone, the humerus, which is a typical long bone. At its proximal end is rounded head that fits into the shallow glenoid cavity of the scapula. Additionally, There's the forearm. Two bones, the radius and the ulna, form the skeleton of the forearm. When the body is in the anatomical position, the radius is the lateral bone. That is, it is on the thumb side of the forearm. When the hands is rotated so that the palm faces backward, the distal end of the radius crosses over and ends up medial to the ulna. Now, let's examine the hands. The skeleton of the hand consists of the carpals, the metacarpals, and the phalanges. The 8 carpal bones arranged in 2 irregular rows of 4 bones each form the part of the hand called the carpus or the wrist. The carpals are bound together by ligaments that restrict movements between them. The palm of the hand consists of the metacarpals. The metacarpals are numbered 1 to 5 from the thumb side of the hand toward the little finger. When the fist is clenched, the heads of the metacarpals become obvious as the knuckles. The phalanges are the bones of the fingers. Each hand consists 14 phalanges. There are 3 in each finger, proximal, middle, and distal, except in the thumb, which has only 2, proximal and distal. We are getting closer to the final info stage. Kyla says cheerfully. Kyla is now telling Rachel about the bones of the pelvic girdle. The pelvic girdle is formed by 2 coxal bones or hip bones and the sacrum, part of the axial skeleton. Each hip bone is the result of fusion of the ilium, ischium, and pubis bones. The pelvic girdle is securely attached to the vertebral column, and the socket for the thigh bone is deep and heavily reinforced. This girdle receives the weight of the upper body and transfers it to the lower limbs. The female pelvis is lighter and broader than the male's. Its inlet and outlet are larger, reflecting the childbearing function. That's it for the pelvic girdle. Let's move on to the bones of the lower limb. The bones of the lower limb include the femur of the thigh, which is the heaviest, strongest, and longest bone in the body. The tibia and fibula of the leg that are connected by interosseous membrane, and the tarsals, metatarsals, and phalanges of the foot, which support our body weight and serves as a lever that allows us to propel our bodies forward when we walk and run. Rachel seemed recovered from the information overload and is ready to take on another round of discussion. So, Kyla starts to talk about the joints of the body. The graceful movements of a ballet dancer and the rough and tumble grapplings of a football player illustrate the great variety of motion that joints allow. With fewer joints, we would move like robots. Joints, also called articulations, are the sites where 2 or more bones meet. They have 2 functions. They hold the bones together securely, but also give the rigid skeleton mobility. Joints are classified functionally and structurally. The functional classification focuses on the amount of movement the joint allows. On this basis, there are synarthrosis or movable joints, amphiarthrosis or slightly movable joints, and diarthrosis or freely movable joints. Immovable and slightly movable joints are restricted mainly to the axial skeleton, where firm attachments and protection of internal organs are priorities. Freely movable joints predominate in the limbs where mobility is important. Structurally, there are fibrous, cartilaginous, and synovial joints. These classifications are based on whether fibrous tissue, cartilage, or a joint cavity separates the bony regions of the joint. As a general rule, fibrous joints are immovable and synovial joints are freely movable. Although cartilaginous joints have both immovable and slightly movable examples, most are amphiarthrotic. All joints of the limbs are synovial joints. In synovial joints, the articulating bone surfaces are covered with articular cartilage and enclosed within the joint cavity by a fibrous capsule lined with a synovial membrane that secretes lubricating synovial fluid. All synovial joints are diarthrosis. Now, let's discuss about the types of synovial joints according to shape. In a plain joint, the articular surfaces are essentially flat and only short slipping or gliding movements are allowed. The intercarpal joints of the wrist are the best examples of plain joints. In a hinge joint, the cylindrical end of one bone fits into a throw-shaped surface on another bone. Angular movement is allowed in just one plane like a door hinge. Example of a hinge joint is the elbow joint. In a pivot joint, the rounded end of one bone fits into a sleeve or ring of bone. In a condylar joint, the egg-shaped articular surface of one bone fits into an oval concavity in another. Condylar joints allow the moving bone to travel 1 from side to side and 2 back and forth, but the bone cannot rotate around its long axis such as the knuckle joints. In saddle joints, each articular surface has both convex and concave areas like a saddle for a horse. These biaxial joints allow essentially the same movements as condylar joints. The best examples of saddle joints are the carpometacarpal joints in the thumb, which are responsible for our opposable thumbs. In a ball and socket joint, the spherical head of bone fits into the round socket in another. These multiaxial joints allow movement in all axes, including rotation, and are the most freely moving synovial joints. The shoulder and hip are examples. Skeletal system plays a major role in the body. It provides framework for the body, protects the vital, soft, and delicate organs, allows movements, stores mineral and fats, and it houses the blood cell formation since marrow cavities are found in certain bodies. We are now done with the skeletal system, its parts and functions. However, all the systems in the body experiences diseases and disturbances. The skeletal system has diseases and conditions that vary with age and the physical activeness of an individual. At this rate, Rachel is eager to know what are these conditions. She is really curious whether her dream has some kind of similarity in real-life diseases that targets the skeletal system of a human. First on the list is rickets. Rickets is a disease of children in which the bones fail to calcify. As a result, the bones soften and the weight-bearing bones of the legs become bowed. Rickets is usually due to a lack of calcium in the diet or lack of vitamin D, which is needed to absorb calcium into the bloodstream. The second condition are well known since it occurs mostly in people who engage in vigorous and intense physical activity. Despite their remarkable strength, bones are susceptible to fractures or breaks throughout the life. During youth, most fractures result from exceptional trauma that twists or smashes the bones. In old age, bones thin and weaken, and fractures occur more often. A fracture in which the bone breaks cleanly but does not penetrate the skin is a closed or simple fracture. When the broken bone ends penetrate through the skin, the fracture is open or compound. In addition, drying of the disc along with the weakening of ligaments of the vertebral column predisposes older people to herniated or slip discs. However, herniation also may result when the vertebral column is subjected to exceptional twisting forces. If the protruding disc presses on the spinal cord or the spinal nerves exiting from the cord, numbness and excruciating pain can result. In the spine, there are several types of abnormal spinal curvatures that can be identified by simple observation. Three of these are scoliosis, kyphosis, and lordosis. These spinal abnormalities may be congenital or present at birth, or may result from disease, poor posture, unequal muscle pull on the spine, or even injury. Few of us pay attention to our joints unless we experience joint pain or inflammation. However, these joint problems can cause a disturbance in our daily life. First, joint injury is dislocation which happens when a bone is forced out of its normal position in the joint cavity. Second is sprain, which is a result when the ligaments or tendons reinforcing a joint are damaged by excessive stretching or are torn away from the bone. Both tendons and ligaments are cords of dense, fibrous connective tissue with a poor blood supply. Thus, sprains heal slowly and can be extremely painful. Third is arthritis, which describes over 100 different inflammatory or degenerative diseases that damage joints. All forms of arthritis have the same initial symptoms, which are pain, stiffness, and swelling of the joint. All forms of arthritis have the same initial symptoms, pain, stiffness, and swelling of the joint. Fourth is osteoarthritis. The most common form of arthritis is a chronic degenerative condition that typically affects the aged. It affects the articular cartilages, and over the years, the cartilage softens, frays, and eventually breaks down. Fifth is rheumatoid arthritis, which is a chronic inflammatory disorder. Its onset is insidious and usually occurs between the ages of 40 and 50, but it may occur at any age. Many joints, particularly those of the fingers, wrists, ankles, and feet, are affected at the same time, and usually in a symmetrical manner. It is autoimmune disease, a disorder in which the body's immune system mistakenly attempts to destroy its own tissues. Lastly, the gouty arthritis or gout is a disease in which uric acid accumulates in the blood and may be deposited as little shaped crystals in the soft tissues of joints. Another disease of the skeletal system is osteoporosis, which is a bone-thinning disease that afflicts half of women over 65 and some 20% of men over the age of 70. The ratio of bone formation to the bone breakdown decreases as osteoblast activity becomes sluggish. Osteoporosis can make the bones so fragile that even a hug or a sneeze can cause bones to fracture. The bones of the spine and the neck of the femur are particularly susceptible. Vertebral collapse frequently results in a hunch-over posture known as the wager's hump. And that concludes our topic for today regarding skeletal systems.